Hello, my name is Brianna, and I'm coming to you with the lower gastrointestinal presentation of diverticulitis. So let's begin. What is diverticulitis? This is inflammation and infection of the bowel mucosa caused by bacteria, food, and fecal matter trapped in one or more diverticuli. Okay, diverticulosis is having one or more diverticuli in the colon without inflammation. So to better break that down, there's these outpouchings in the colon due to pressure building when you're pushing real hard when you got to pass stool, and it causes these outpouchings and food. Bacteria can get trapped inside of that little back area and it causes infection, it causes inflamed, and if it's severe, it can go to perforation. So let's continue with the presentation. Not all clients who have diverticulosis develop diverticulitis. So diverticulosis is you're just having any one or more of those outpouchings. Diverticulitis is when it's inflamed, one or all of them. Okay, diverticuli is one. Okay, having one outpouching. Okay, diverticulum is more than one. Okay, diverticulum is one, and diverticula is more than one. When all of those are inflamed, it becomes known as diverticulitis. Okay, so let's continue. A little priority tip: remember to cleanse the bowel prior to surgery in diverticulitis. A bowel prep with neomycin is used when prescribed. So when you're doing in-text questions, you want to, if there's an answer that's saying give the bowel, cleanse the bowel, you want to go more towards that one because you have to understand what GI is consisted of, bacteria, and it can go to sepsis really quick. So we want to make sure we clean them out really good. Our next slide. So the findings, so that you know if you have it or someone else has it, there will be an acute onset of abdominal pain in the lower left quadrant, usually in the sigmoid colon area, because that's where a lot of that pressure is being transferred to. So it's right here on my left lower side. Okay, nausea and vomiting. Okay, it can be painful, especially when it's inflamed. You know, it's causing trouble with the bowel being able to empty, with it being affected like that. So it can cause a slow elimination. This can cause nausea, maybe some vomiting too. Fever. Anytime there is inflammation, you got to know there's fever associated with it. Fever is your body's defense system to try to turn up the heat to like melt or evaporate the bacteria. Okay, chills. It's just when you have the chills is caused by rapid relaxation and contraction of your muscles. With inflammation, it's like a pulsation going on, so they can have effects of chills because of that. Tachycardia. Anytime there's infection, understand that diverticulitis, those pouches are inflamed. Okay, they're already at the bad part. So increased heart rate due to the fact that your body's trying to get rush blood to the area that's filled with white blood cells, trying to get rid of the infection. So it's trying to get rid of it for you. It's gonna have a rapid heart rate. Anytime you have fever, inflammation, your heart rate's gonna be rapid. Put that in the back of your mind when it comes to these questions. Abdominal distension, when there's inflammation, that muscle is not how it's not relaxed how it used to be. It's messed with. So it's a lot of blood being pulled to the area, trying to get rid of that infection. So it's not going to be normal looking. It's going to be a little bit puffy. Just think about it. You have a sore. It gets inflamed. It gets a little puffy. That's exactly what's happening inside that colon there. So abdominal distension. Understand when we're doing our abdominal assessments, when we have distension, that's why we want to look at why if they have distension or not. Let's go to the next slide. Labs that we could use to help us target this is it, diverticulitis or not. Hematocrit and hemoglobin. It's going to be low. We're going to be bleeding internally at this point. So that sac has ruptured open, so all of its content has seeped into the peritoneal cavity, can lead to peritonitis, and it's going to be very severe. Okay, so look at our levels; those labs are going to be down. All right, ESR is to detect for inflammation, and that's going to be increased. White blood cell, we already know. Anytime there's inflammation, increase in white blood cells. Okay, can be a decrease in red blood cells because we're going to be bleeding out, but an increase in white blood cells because we're trying to get rid of the infection. Stools for a cold blood can be positive, yeah, because we got to think about where it's happening in close to the rectum, so that blood can instead of seeping out and go backwards and be inside the poo. So it can be possible to have cold blood. Barium enema. This is to visualize. It'll help us see if something is bursted open. It just gives us a visualization of the colon. That'll help us see. MRIs are used in all inflammatory bowel disorders. Contrast dyes are used. Now, understand when you have contrast dye, make sure that patient doesn't have a kidney problem because we need to be able to filter this out. So I also watch for your allergy. So our next slide. For severe manifestations, there'll be severe pain, high fever, and the client is usually hospitalized at this point. But some people don't get to it in time, and they can be experiencing this pain by themselves. So it's very good to know about these disorders to help yourself and other people to be aware of these things. It can happen to anybody. We want nothing.
I wanted to say with the barium enema, they're going to insert this into the rectum. It's an enema. So you really you don't have to worry about the kidneys. It's as if let's say an MRI, they need that contrast dye. Just be mindful that if you have for future questions when it comes to a barium, you want to be able to excrete that, or contrast dye. You want to be able to excrete that out. You can't with your kidneys being bad, and it can cause toxicity there. So be mindful of that.
Our mouth, we need the bowel to be at rest. You might get internal feedings, but we need your bowel at rest. Receive nasogastric suction. We want to just clear the bowel. We don't want anything in there that can further further damage, or you know the word I'm looking for, to further increase the intensity of this infection. Okay, because the food that we eat contain bacteria too. Okay, we gotta be mindful of those things. IV fluids. If the person's seeping out their content, you know what I'm saying. They're not there. Just think about what the bowels do. They help absorb that water, and this is happening mainly in the colon, the large intestine. The large intestine is responsible for absorbing almost all of your water. So if that part is hurt or not able to function, we need something to get in and get our fluids in. That's important. IV antibiotics. We're going to need that. Okay. Any kind of inflammation, we need antibiotics fast. Okay. We don't want to go to sepsis. Opioids. We need something for pain. Okay. This stuff is going to hurt. This inflammation of our organs. Okay. For mild cases, when they struggle to take prescribed medications for pain, the infection, and the spasm, antispasmodics, we need that. Okay, we also want to educate the patients to promote normal bowel functions, no laxatives. We don't want to put extra stress on the bowel. I know you might say, well, laxatives going to, but we don't want you taking laxatives, first of all, because we've already had a problem with your fluid intake because your bowel's not able to absorb like it should because it's injured. If you're taking laxatives, it's going to cause you diarrhea, which is going to further deplete you of your fluids. This is not good for that alone. And then two, we don't want all that going on when your bowel is open, okay? We're trying to get it to heal, and you take this laxative, you can seep all that poo out and go straight onto the peritoneal cavity. You have to make a chain reaction when it comes to thinking as like a nurse with these conditions, okay? All right, what we want to do, we want to avoid seeds or indigestible materials such as nuts, popcorn, seeds. When we say indigestible, it's hard to digest, really. You don't see popcorn seeds in your poo when you eat popcorn, do you? No, it's just hard to get those passed, and they can get stuck before they get passed, okay? And these can block those diverticulums, and you gotta understand those outpouching. When it outpouches, that mucosa layer still has bacteria, normal flora in it, but that normal bacteria can turn to bad bacteria for any second, any time. So we don't want to risk that, especially when that part of that bowel is weak, all right? Avoid foods or drinks. Yes, we want to avoid foods and drinks that can irritate the bowels. Avoid alcohol. Just imagine pouring alcohol on your scar when you get a boo-boo. Now imagine drinking alcohol and you got a boo-boo internally and I wonder if we want to go back to the avoid the food that can block it. Well, if it's blocked, that pressure, it's just sitting there, got bacteria on it as well, because we're dealing with poo in this area. So that food have already came in contact with some bacteria that's probably stuck to it. And if it gets stuck in that outpouching, your chances of infection. Okay, so we want to avoid those foods. All right. Limit fat to 30% of daily calorie intake. That can cause diarrhea, and we want well-formed stools. Okay. Consume a clear liquid diet until manifestations subside. We don't want to eat a normal diet. We need our bowel to be at rest while it's healing. So we're going to gradually go to the normal food. Okay. Clear liquid diet, low fiber when the process of healing. Look, that's going to be a test. Low fiber while the bowel is healing. Then after it heals, you want to go to a high fiber diet. Okay. So we're going to be on progressively low fiber diet when solid foods are tolerated without other manifestations. Slowly advance to a high fiber diet is tolerated when inflammation resolves. Okay. All right, so our medications that we're going to take to treat diverticulitis, we're going to take some antimicrobials, of course. We're going to discontinue sulfaflaxin if you have tendon pain, okay? Moderate kidney function, decreased dose of antimicrobials if impaired. We don't want to make it toxic for us, okay? Kidneys not able to filter out these drugs could be a problem, okay? This antimicrobials can cause super infections, so you want to watch for that thrush.
The main thing that you want to take from this lecture is constipation. Excuse my handwriting. Constipation, straining can cause these outpouchings, okay?
Vaginal yeast infections. These things are getting rid of your good bacteria as well. So, as we stated, the antimicrobial drugs, they're treating the good bacteria we have and the bad. So, depending on how long that we're on these antibiotics or antimicrobials, it can tell us, let us know how long, depending on how long we're taking these antimicrobials can affect the good bacteria that we have as well, and it can cause these super infections like those that thrush. Even though we're treating this, it's messing with all the good bacteria that we have. It's a broad spectrum, so super infection is possible. Okay, urine can be dark, expected, and that's harmless. So when someone complains, know your side effects to different antimicrobials or drugs in period, because in general, because patients might say, well, why is my urine orange? Well, if you're taking rifampin, for TB and your urine turns orange, you say, what's wrong? No, it's normal. If they didn't know that, it can go problems with your mind. So you can have that as well. You want to monitor for central nervous system effects, numbness of extremities, ataxia, seizures, and notify provider immediately if present, because this can lead to shock. Okay, you got bacteria that has an open access, like an open door to your peritoneal cavity, and that area is sterile. So when that gets inflamed, the whole list leads to multiple organ failure here. Okay, just think of that inflamed area. Squeezing those organs. What organs are wrapped inside that membrane? You got your large and small intestines, your stomach, your pancreas, your spleen, everything below that diaphragm is in that peritoneal cavity. Your spleen as well. When it gets inflamed, that bacteria, it's going to get inflamed. It's going to get puffy. It's going to squeeze that. So if we have these, this leads to shock. Just think about somebody just acting as if you're
your liver as well is included in this area, and it can get scrosed. So you want to watch for peritonitis.
It's a trunk and get a pile of poo bacteria and slap it up in there. That bacteria is going to eat away those vessels, because that's what bacteria does when it has its freedom, okay? It's eating that stuff. Your vessel can turn holes in it, leaking out your content. This can lead to hypovolemic shock, septic shock. So, want to watch for these GI problems, okay? The procedure to help with this disease, of course, you're going to have a colon resection to get rid of that inflamed area, especially if the treatment is not working right, or you came in later, which you're supposed to, and, we just need to hurry and get this out before, shock comes in. Complications. Peritonitis, we just talked about that. Gonna have a rigid board-like abdomen, because all that bacteria is in there, it's not supposed to, so it's inflamed, it's gonna be a rigid, board-like. That's the hallmark sign of peritonitis. Abdominal distension, why? It's inflamed again. Nausea, vomiting, of course, all that stuff is squeezing, it's gonna get rid of that stuff in that stomach. Rebound tenderness, of course, it's gonna hurt. Notice your signs of your symptoms of inflammation. You're gonna have pain, swelling, fever, tenderness, redness, and edema. That's one. Okay. So what we're going to do if a patient is going through peritonitis, we're going to place them in a semi-Fowler's position to promote drainage, monitor respiratory status. You got to understand that cavity is under the diaphragm, but if it's inflamed, it can push up on those lungs. We're going to watch that. give oxygen. You want to have them to cough and deep breathe, and they might need mechanical ventilation. Okay, nasal gastric suctioning. You want to get that whatever's in that bowel out. Okay, and you want double lumen too for these suctions here. Keep nothing about mouth. Anytime we're having problems with our bowels, we want to keep it. We want rest. Think of rest when we're having bowel problems. Okay, we're not gonna be eating like that. We want to give antibiotics. That's the first thing right there. We don't want to go to septic shock here. Monitor fluids and electrolytes. Our organ that deals with intaking those fluids that we drink, electrolytes, is impaired. So we want to watch for that because electrolytes being out of whack can be very detrimental. Okay. Other complications, we can have bleeding due to the deterioration of the bowel. When it's inflamed to the point to where it just has to burst, you just gotta know there's gonna be bleeding along with the emptying of the colon's content. Okay. You want to observe for rectal bleeding, that black tarry stool, bright red blood. Okay. Check the vital signs. You can probably catch shock early, have that compensation little phase, increased heart rate, increased blood pressure. We're trying to get stuff, saved before we can't no more. Your organs, your body's going to go out trying, okay? Always, unless something just really bad. Your labs, you want to check your hematocrit, which is going to be low. Hemoglobin's going to be low. Coagulation factor, they might be low due to DIC, depending on how severe your bleeding is or how many of those diverticulums have bursted. You just put it in mind. We're thinking about one, but all of them can be inflamed and burst at the same time, okay? Check fluids and electrolytes. Of course, we talked about that. Abscess and fistula formation due to that healing and non-healing. You can create these little tunnels, okay, that can cause poo to go into your vaginal area. It can cause UTIs, It's like when you think of fistula, they're like little tunnels to little gateways to different other parts of the body. It shouldn't be there. Okay, due to the destruction of the bowel wall leading to infection, okay, fistulas are tunnels created by severe injury caused by our own immune system because with this information triggers your immune system and it can be overreactive and it can cause these tunnels to be made. Okay, toxic metacolon. Let's say this area of your colon has been injured too many times. It is tired. It's not working anymore. But let's say you don't know. I don't know how. Let's say you don't know, and it's just sitting there inside of your body, just soaking up all that water like a sponge, and then eventually it's going to burst. So this is a medical emergency here. Okay, due to inactivity of the colon, because at this part it hurts to the point where it can't do anything. Massive colon dilation occurs due to it soaking up that water, and client becomes at risk for perforation at this part. So you got to understand. Some parts, you got levels to the hurt, okay? The main part that's hurt is the part that bursted, and below that area, those areas are levels is reaching to that part there, okay? There's levels to it, so some parts of the bowel might not be as severe as the other ones, but there's still some injury there, okay? I hope this helped y'all. Here's a summary of diverticulitis. It's outpouching due to constipation. You're straining a lot. Let's say you're not getting enough fiber in your diet. You're not drinking enough water, okay? When you go to the bathroom, you push that, trying to get that hard poo out. That pressure builds up, and it causes an outpouching or ballooning of your colon, and this can become infected due to the fact that one, you have bacteria that's naturally in the colon, and this area that's pouched out, that bacteria can get inside of there and it's weak. It's not how it's supposed to be, so the area is weak. So that bacteria can play with that area of that bowel. And then let's say you're eating foods that's not supposed to, that's contraindicated to when you're having this condition, that food gets stuck in there. To understand that it has wrapped around some bacteria on its way down there, and it probably got bacteria on its circumference, and it's stuck in there. That bacteria leap off and eat away at that area and cause inflammation. Okay, we don't want to taking you laxative when we're trying to heal from diverticulitis. Stay away from seeds, nuts. Okay, you want your fiber. When you're in the process of healing from this disorder, you want a low fiber diet. We don't want you diarrheaing. We don't want you straining anymore. We want you to rest. And after inflammation is gone, your pain is gone, then you're going to reorganize your diet. Okay, to include more fiber. Okay, because we don't want to be constipated every time we go to the bathroom. This is what causes this in the first place. Excuse me. Complications, peritonitis, toxic metacolon, fluid electrolyte imbalances, bleeding of your bowels. You can bleed internal to death with here, depending on how severe it is. So if you know somebody who got these symptoms, let them know. Go ahead and go to the doctor, get them antimicrobials, their antibiotics to treat this because it can lead to sepsis. If that pouch bursts open, all this content is inside that peritoneal cavity. This can lead to severe shock, like shock for real. Your multi-organ failure, all those organs are being squished on. So, somebody who has diverticulitis, show them this video to educate, tell them to increase their fiber. I hope you learned something. Stay tuned for the questions to this lecture, the NCLEX questions. Thank you. I hope you enjoyed it.
Now, when I say the fiber, we want not when they're hurting, after their inflammation is gone. And to prevent this from happening again, or to prevent it in general, you want to have fiber an adequate amount in your diet. Okay, so we don't want to prevent diverticulitis or diverticulosis. We want to increase fiber. Okay, this is going to prevent us from straining, creating that pressure. Thank you.